How many must die? How many must die before you drop the housing hoax and start dealing with this? We have 1,000 so far in 2019. Is it 1,200? Is it 10,000? How many must die before you stop the rhetoric, stop the hoax, and start dealing with the problem? How many must die? Do I have to ask that question as a doctor?
That was Dr. Drew with Greg on Fox Nation. With the homeless crisis in California hitting a breaking point, health experts have been issuing dire warnings and an alarming new report saying the rise in homelessness is fueling a dangerous rat infestation in Los Angeles and other major cities across the state. Some of these experts are now demanding the governor stop ignoring the problem and declare a public health emergency. And we have a special treat. Dr. Drew Pinsky joins us now. It is so good to have you here.
Thank you. It's a pleasure to be here. Big fan.
So you're quite passionate about this, and for good reason.
It scared me. I scared Greg, but as a physician, I wake up every day looking at this, and it incensed me. I've practiced in the area for 30 years, and of course, one is one talk show host to another, whom you should never trust a talk show, as you pointed out. But just making sure we both understand. But I practiced medicine for 30 years. Please don't confuse my success in the media with my day job, where I've been an assistant clinical professor of medicine and psychiatry, and I've run departments in a psychiatric hospital. These are my patients on the street. I know who they are. I've treated this population for years, and it is ridiculous that they're calling it a housing problem. It is ridiculous. The rat thing, I saw that coming 18 months ago. I predicted the typhus epidemic. It hit and is amongst us now. The problem is there are things that follow typhus. Given that they've done nothing for this rat population, there are other illnesses that will follow. We have tuberculosis exploding. We will see Yersinia, which you may know as plague. We have potential measles. We have people, their excrement and their bleeding and they're urinating in the street every day that is getting washed directly into the LA River. 60,000 people's excrement is getting into the river, into the ocean every day. Wow. If I had a city of 60,000 people that was disconnected from the sewage treatment plant, my God, the environmentalists would freak out. Where are they? Then we have mammalian die-off off our coast now. Mammalian sea life, dolphins, sea lions dying because of all this garbage, untreated, going directly into the ocean. Where's the help?
But what about the plastic straws?
The plastic straw got a turtle, but this is insane. We've gone insane. And unfortunately, the city of Los Angeles is maintaining this rhetoric that it's a housing problem. Look, guys, conservatively, the city of Los Angeles absorbed about 800,000 undocumented immigrants in the last year or so. They're all living in a house. None of them are on the street. 800,000 people without a penny, without a family, without a country, found a place to live. Now, either they pushed people into the streets, which I'm not prepared to say, or they found a place to live. And this housing rhetoric is a hoax, is a mental health crisis, this is an addiction crisis, and it is a general health crisis.
So what do the hospitals look like in the ERs with all
It's a catastrophe, and we can't do anything for or to these people if they say, I don't want treatment or care.
Oh, is that what people are saying?
That's the problem. They don't want the care, and we can't do anything to render the care unless we do something to change the Lanterman and Petrus Act, which is what is the current law.
Is that a state or federal law?
I believe it's a federal decision, if I'm correct, but it has to be sort of modified in some way to include a broader definition of gravely disabled that includes inability to care for your nutrition or your medical needs, so people can help these people. Right now, this is the dirty little secret. Most of them don't want the help and don't want the housing. And this because of the brain condition. Imagine if they were demented patients walking around saying this. People would be incensed.
Well, I mean, if it's the bad, well.